Welcome, everyone. I'm here to give the other side of the equation to what Deb spoke about from the patient's perspective. I have no disclosures to announce. A little agenda of what I'm going to speak about. I'm going to give a little introduction about some of the benefits and risks of using new technologies to communicate between clinics and patients. Then I'm going to go through several of the potential platforms for communication and then have some closing thoughts. So it was the late 1980s. I was a young man recently diagnosed with Hemophilia A, and my family was just getting used to that idea. You see my sister there, and my parents, not having much experience with the disease, were still trying to get used to the idea. And our support system, too, was trying to figure out what to do with this only kid in the community who had a severe bleeding disorder. So I was that kid in kindergarten who had the padded desk and the helmet on. At that time, we didn't have a lot of the communication techniques that we have now to connect with our clinic. So we were pretty much limited to the phone, snail mail, and going to the clinic. So on the top left there, you see our family's early 1980s Chevette, which often ended up with my dad speeding down Commissioner Street in our hometown, trying to get us to the hospital to go to clinic or to get there quickly if we needed an infusion before home infusion was available. So we drove that Chevette like it's a Corvette. In those days, we didn't have cell phones either. Just to kind of give you a little perspective on the time period we're dealing with, you can see what cell phones look like at that time. So when we arrived at clinic, it looked something like this, albeit we were children. And the clinics were really amazing things. That's where we really got our first taste of community in the inherited bleeding disorders community. So we did it on weekends. So all of the families would come at once. The society would hold games while we were waiting. The parents got an opportunity to meet other parents who were going through the same things they were and who they could call in the middle of the night if they were worrying about their son and have somebody to tell them that everything was going to be okay. It's where I, as a young man, met a lot of older boys or older men who became my role model. So in terms of new technologies, there's a real opportunity here, like in any field, that technology can definitely improve patient care. It's a way to communicate more quickly, more easily, and more conveniently. But we have to remember that with those opportunities also comes risk. The major risk being breaching patient confidentiality, and also issues of liability in other areas. As well as patients, we often want to use these platforms that we're used to using in other areas of our life without really giving it a second thought in our healthcare. And that may not always be appropriate, and that may not always put our healthcare practitioners in the easiest position. So the first one I want to talk about is email. Email isn't always guaranteed to be private, depending on the platform that you're using. Certainly, if you are using a work email, there's a good chance that that could be monitored, or if you're using a work computer system, that's content that you don't really own and that somebody could be observing, maybe somebody that you don't want to be, and could find out what you're communicating with your clinic. I think as I've started to use email more and more with my clinic, I think that I can get more creative with it. If I'm having a bleed or something that seems like a bleed, I'll think, okay, I'll take a photo of this, send this in, say my ankle looks a little purple, what do you think? That might not necessarily be a substitute for going in and seeing the clinic. Chances are if the clinic's unsure, they're going to want to be safe and ask me to come in. The other thing to really think about with email is who is monitoring email and how often is it checked. We may, as patients, get so used to emailing our clinics that we expect a quick response. If it's the holidays, you might not get a response. If it's night, if somebody who checks the email at the clinic is on vacation, if you're having an urgent bleeding issue and trying to communicate that, that might not be the best idea. Remember to keep communications with your healthcare practitioner's professional as well. When you're communicating with them through email, those emails will be kept as records and as part of your file. When we're communicating with people, when we're in person, there's a certain amount of decorum and respect that you show people that may not necessarily be translated into email. I'm sure we can all relate to experiences where you've sent someone an email and they receive it and take it out of context, or vice versa. So you want to be really careful with your clinic while doing that. I've had experiences with my clinic where I've certainly misinterpreted their emails and have said things to them that I probably wouldn't say to their faces. So definitely recommend that if you get an email that you're unsure about, the best thing to do is to call them or to speak to them in person. Smartphones, we just talked about texting. Be careful if you're in public places using your cell phone to communicate with your clinic. It might be possible for people to eavesdrop on those communications or to see what you're communicating. One of the benefits of our smartphones is that they're small and they're easy to carry around, and you can transport a lot of information. That also makes them easy to be stolen or lost. So any of your devices you want to have password protected, and if it is an app that can easily be accessed, then you want to ensure that those are password protected as well, or that you're not putting information in there that you wouldn't want somebody else seeing. Again, going back to that point about using a work system or a system that belongs to somebody else. If you're emailing to your clinic, you want to make sure that you're using a personal account on a personal system, so that if you are communicating information that you wouldn't want shared with anybody else, that you have a little bit more security. You want to check those numbers and addresses, double check them before you communicate with your clinic. I'm not sure if any of you have been through the unfortunate circumstance at your work or somewhere else where you accidentally hit that reply all button and send something you don't want everyone to see. Certainly this could be the case with smartphones as well. You might get the number wrong, click on the wrong contact, and send private information to somebody that you don't want to see it. And finally, you want to be really careful with acronyms when communicating with your clinic. There may be acronyms that we use when we're texting that everybody doesn't have, everyone doesn't have the same understanding of. So be careful when you're asking, where's the factor? Social media, more and more people are using social media platforms, which Deb has spoken about a little bit. Anything that you post to social media, you basically want to consider public, even if it's in a private chat setting. Somebody else owns that content, and if there were ever an information request or a legal issue, that information could be made public. Sometimes they say about social media that it's akin to posting something on the front page of the newspaper, just in terms of the level of privacy you have. So you want to be careful about that. The other thing about social media is you'll see a lot of patient groups in which people are sharing opinions on what to do about health-related issues. Remember that you're not a doctor. Playing doctor should be left to professionals and curious youngsters. What you want to do is make sure that if you really believe that raisins will stop nosebleeds, certainly don't go on to social media and tell people to stop taking their cyclocaparin. Leave medical advice to the professionals. As well, the other thing about social media and situations like Deb mentioned, in which patients may be requesting to befriend one of their healthcare practitioners on social media, is it's not just the healthcare practitioner saying, my public, private life, I'm not sure that I want to connect with these people. As a patient, you probably want to remember, too, that you may have content that you don't necessarily want your clinic to know, and that they may not want to know. So here's a picture that my clinic found of me. This is definitely a red light activity. I was wearing a helmet, though, in my defense, so I did have quite a conversation with Lori about this one. My clinic also found out about my prior life of crime through social media. That was embarrassing. As well, they found out about some bad haircut choices in the past. As Deb mentioned, a lot of professional associations for healthcare practitioners recommend to them that they have a public and a private account, so that if they want to connect with patients, to use the public account. So that's a good thing to explore if you're looking to befriend one of your healthcare practitioners on social media. You want to try to find out if they have a public account first before putting them in an awkward position where they feel that they may have to reveal aspects of their private life to you. And also, if you're communicating with a clinic or a public account for a healthcare practitioner, you want to find out how often those accounts are monitored. It's possible that they have accounts to promote a special clinic that they're doing or a special activity, but over time those may not be monitored. Again, if you're in an urgent medical situation, you don't want to be contacting a system where you're not sure who will get back to you or when they'll get back to you. Video conferencing. Here you see our Prime Minister of Canada video conferencing with some constituents. That's a really useful tool because you can kind of have an in-face conversation with your clinic. It might avoid some of those communications issues that you come into with texting and email with things being taken out of context. It probably makes assessment a little bit easier to do video conferencing than some of the other platforms that we're talking about today. If they want to see how far you can bend your elbow or what the bruise looks like from different angles, it's definitely a better way to communicate than some of the other platforms that I've spoken about, but it may not be a replacement for in-person consultations. It's especially useful in large geographic areas for clinics that are serving patients who have trouble either getting to clinic or have mobility issues. But again, the patient should be understanding that even though you have this really great technology, that you may still need to go into the clinic if you're having an issue. Lots of patients are now blogging, so separate from their national member organizations, just individually they may start blogs that they use social media to make contact with other patients. And it's a good way for patients to share their stories and kind of build that kinship with other people who may be going through the same things that they are. On those blogs, if you're doing them, you really want to avoid talking about other patients' stories without their consent. If you are doing that, you want to avoid using any information that could breach their confidentiality. So the more information that you provide in a blog, the more detail, talking about what happened, how it happened, the date, the name of the hospital that provided the treatment, the more detail there is, the more risk there is of breaching that confidentiality. A lot of people blog anonymously. You want to be careful about this as well. Even if you blog it anonymously, it is possible to trace the author. Sometimes people blog anonymously because they feel that they can say things that they might not necessarily say if their identity were known. So again, you want to be professional in any content that you're putting on the internet because you don't know how many times that's going to be redistributed, who's taken a screenshot of it, who's copied it, shared it, liked it. Even if you delete it from your account, quite often that information can be found. Okay. So just some conclusions, some closing thoughts. Patients really need to make informed decisions about using electronic communications with their clinics. And the best thing to do is to have a signed agreement. Often clinics in different areas will have a signed agreement that kind of lays out the terms of engagement for electronic communication. That's a great thing to have so that both the clinic and the patient are agreeing to how communication will happen. And there should be a discussion around that. It shouldn't just be handing the patient a piece of paper and asking them to sign it. There should be a discussion that includes the patient about what works best for them and what their needs are. And things that you would want to address in that discussion is who in the clinic has access to each electronic platform, how communications are processed, who will reply, when replies can be expected, and how replies will be delivered. Thank you very much.